Hello everyone, I'm Usha Pradhan and my student ID is 2217106A, and today I'll be discussing about voluntary assisted dying, which is also known as VAD, and where I'll talk about the ethical principles and ensuring quality care surrounding in palliative care. In this slide, I'm gonna give short introduction and overview of VAD. VAD is a legally regulated process in which an eligible individual with an advanced illness experiencing intolerable suffering may seek medical assistance to end their life. VAD is now legal across all Australian states and the Australian Capital Territory, meaning nurses working in palliative care are increasingly involved in VAD-related discussion and care planning. VAD is still a very high controversial topic within healthcare and palliative care. Supporters still believe that it respects patient autonomy, dignity, and relief from suffering. However, opponents argue that healthcare professionals should focus on preserving life and improving palliative care rather than assisting death. There are also concerns regarding patient vulnerability, coercion, ethical and religious beliefs, and the emotional impact on healthcare professionals involved in VAD-related care. As a result, now nurses have played a very important role in patient advocacy, communication, symptom management, and emotional support and advanced care planning throughout the VAD process. The first ethical principle is autonomy, which refers to respecting a patient's right to make independent decisions regarding their healthcare. Supporters of VAD believe that patients with incurable illness should have the right to decide how and when they die, particularly when experiencing severe pain, loss of independence, or emotional suffering. Autonomy is closely linked to patient-centered care because it allows patients to make informed decisions about their own bodies while maintaining dignity and personal control at the end of their life. However, there are also concerns regarding autonomy. Opponents argue that vulnerable patients may feel pressure to choose VAD because they fear becoming a burden on their family members, caregivers, or society. Mental health conditions, emotional distress, and social influences may also affect a patient's ability to make fully voluntary decisions. Therefore, healthcare professionals must carefully assess decision-making capacity and ensure that patients are making informed and independent choices throughout the VAD process. Overall, autonomy supports patient choice and self-determination. However, concerns remain regarding coercion and patient vulnerability. The second ethical principle is beneficence, which means acting in the best interest of the patient. Supporters of VAD believe that it may help reduce unbearable suffering and allow terminally ill patients to die peacefully with dignity, especially when symptoms cannot be fully controlled despite high quality care. Some patients also report feeling comforted simply by knowing that VAD is available as an option, even if they do not ultimately proceed with it. However, opponents argue that beneficence should focus on improving palliative care rather than intentionally ending life. Palliative care aims to improve quality of life through pain management, emotional support, spiritual care, and holistic patient-centered care. There are also concerns that legalizing VAD may reduce focus on further improving palliative care services or create the perception that some lives are less valuable than others. Therefore, although VAD may reduce suffering for some individuals, debate continue regarding whether intentionally ending life can be truly considered beneficial healthcare. The third ethical principle is non-maleficence, which means do not harm. Supporters of VAD argue that prolonging severe suffering for terminally ill patient may itself cause harm. Some patients experience ongoing pain, emotional distress, loss of dignity, and reduced quality of life because of advanced illness. In this situation, supporters believe VAD may help reduce suffering and prevent further harm for patients experiencing unbearable symptoms. However, opponents argue that intentionally causing death directly conflicts with the healthcare professionals' duty to protect life and avoid harm. Research also shows that nurses and healthcare professionals involved in VAD care may experience emotional distress, moral conflict, and ethical challenges, particularly when VAD conflicts with their personal, cultural, or religious belief. Therefore, non-maleficence remains one of the most debated and ethical principles surrounding VAD in healthcare and palliative care practice. The fourth ethical principle is justice, which relates to fairness and equal access to healthcare. Supporters argue that all eligible patients should have equal access to VAD, regardless of their cultural background, location, or financial circumstances, as denying access may unnecessarily prolong suffering. Justice also involves respecting diverse cultural beliefs and personal values regarding end of life care. However, opponents raise concerns that vulnerable individuals may feel pressure to choose VAD due to inadequate social or healthcare support systems. Concerns have also been raised about unequal access to palliative care services in rural and remote areas of Australia. Therefore, justice emphasizes the need for strong legal safeguard, equitable healthcare access, and protection for vulnerable population throughout the VAD process. I'll be talking about ensuring quality care now, compassionate and patient-centered care. Ensuring quality care remains extremely important for patients who choose VAD. Nurses and healthcare professionals must provide compassionate, respectful, and non-judgmental care so that the patient feels supported regardless of personal opinions about VAD. Patient-centered care involves respecting the individual's dignity, cultural beliefs, personal values, and end-of-life wishes. Clear and effective communication is also essential. Patients should receive honest and accurate information about their diagnosis, treatment options, palliative care, and VAD process so that they can make informed decisions regarding their care. In addition, emotional support should be provided to both patient and the families throughout the VAD process. Research also suggests that respectful communication and compassionate care can improve emotional well-being, trust, and overall experience of end-of-life care. Moving on to the next slide, symptom management and holistic care. High quality palliative care remains essential for patients who choose VAD. Nurses and other healthcare professionals should continue to provide very compassionate, respectful, and non-judgmental care so that the patient feel very supported regardless of personal opinions regarding VAD. Healthcare professionals must also respect the patient's dignity, cultural belief, personal values, and end-of-life wishes throughout the care process. Effective communication is very important because patient needs clear and accurate information regarding the diagnosis, treatment option, palliative care, and VAD process in order to make informed decision about their care. Emotional support should also be provided to both patient and the families during difficulty time period. Research also suggests that respectful communication and supporting nursing care can improve patient trust, emotional well-being, and overall quality of end-of-life care. Importantly, VAD should not replace palliative care, but should be considered one possible option within end-of-life care. When we talk about multidisciplinary teamwork and nurse support, quality care for patients choosing VAD depends on effectively multidisciplinary teamwork between healthcare professionals, nurses, doctors, pharmacists, psychologists, social worker, and palliative care specialists all play a very important role in ensuring care is very safe, coordinated, and patient-centered throughout the VAD process. Healthcare professionals must also follow legal and ethical guidelines carefully to maintain patient safety and professional standards of practice. Researchers also say that nurses involved in VAD care may experience emotional distress, ethical uncertainty, and moral conflict, particularly when VAD differs from personal beliefs or value. Therefore, education, training, and emotional support are important to help nurses develop confidence and provide compassionate care safely and effectively. Although Australian legislation allows healthcare professionals to refuse involvement in VAD because of objection, they still have a professional responsibility to provide respectful, safe, and non-disciplinary care to all the patients. Overall, quality VAD care requires strong communication, teamwork, symptoms management, and effective legal and ethical safeguards. And this is my conclusion page. In conclusion, voluntary assisted dying remains one of the most ethically complex and controversial issues in contemporary healthcare. The four ethical principles of autonomy, beneficence, non-maleficence, and justice all contribute to ongoing argument both supporting and opposing VAD. Supporters also focuses on patient autonomy, dignity, and relief from suffering, whereas opponent emphasizes the protection of life, prevention of harm, and safeguarding vulnerable individuals. Despite these all ethical debates, maintaining high quality care for patients who chose VAD is extremely important. Nurses and healthcare professionals must continue to provide compassionate, respectful, and evidence-based care throughout effective communication. As VAD continues to influence palliative care practice in Australia, nurses must balance ethical and professional responsibility while prioritizing patient-centered care, dignity, and quality end-of-life care. And I have listed all of my reference after the conclusion page. Thank you.